Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. On today's show, I have Nikki Lawley. Nikki is a cannabis advocate and educator, and she's also a pediatric nurse. Nikki, welcome. How are you doing today?
Doing well here in Buffalo, New York.
Fantastic. How are things in New York?
Things are very colorful. I'm missing our Cannabis Control Board meeting because we're recording our podcast. But that is okay because it's recorded, so I can catch it right after us. But
Cool.
the adult use dispensary and cultivation are being kind of voted on today by the board. So it's kind of a big, exciting day. Lots of leaks, on LinkedIn, you're seeing a lot of different people posting different things. And I mean, it sounds really great on the surface until you see the fine print. Once you start reading the fine print, there's really no social equity involved. There's really you've got to literally, like they're saying, if you've had a prior conviction, you're going to the head of the class, the first 100 licenses are going to be given to those harmed by the war on drugs or their families. And then when you read it, you have to already have an operational profitable business for 2 years in order to qualify. I don't know about you, but if someone's been convicted of a marijuana felony, you pretty much aren't probably operating a store because you couldn't get a loan to operate. I'm just saying, I mean, it's the most preposterous requirement and it just gets uglier from there. You've got to have Y and Z, and that is not social equity.
That is not, and that's disappointing to hear. Well, thank you. Actually, I feel quite privileged that you've taken time out to chat to me today, but that is quite disappointing because, we're here in the UK, but we're hearing a lot about new states that are rolling out in the US, and New York is being held up as one of the ones that sort of decided to go about it in a kind of social equity sensitive way. So it's disappointing when you hear details like that. And that could be a whole different show on its own. So we're not going to go down that rabbit hole today. We're going to talk actually much more about you and your journey and how you become an advocate. And maybe actually just let's start with a bit about your background and how you kind of got into this space and, as an advocate and educator. Would you mind just sort of giving us your backstory a bit?
Sure. About 5 years ago, I was working as a pediatric nurse. A child was feeling a little combative for a vaccine, and he headbutted me. I was thrown against a wall and back into his head. I was just doing my job. It was like any other day. My life literally changed in a second. Coincidentally, it left me with a traumatic brain injury as well as cervical instability. March is Brain Injury Awareness Month. And as a nurse, I wasn't educated that much on brain injury. I mean, we had kids get concussions all the time, right? Just go home and rest. And then most are fine, but I truly expected to be the same way. And it was a headache that literally started the moment I got hit. And I still have that today, 5 years. And it's a 7 out of 10 before I medicate with cannabis. And being a medical professional, I was always respected in my field. I was always, I'm a worker bee. I worked as a casino dealer and a pediatric nurse at the same time for 7 years. Who does that? But I loved both jobs. And, so I had like this full on credibility thing going on, and I was respected by my colleagues and peers. And one thing I've learned about brain injury is it's invisible. And people don't understand that at all. There's more awareness coming now because of COVID and all the lockdowns and the anxiety and the depression that's really crept up more than ever, where it's being talked about. And it's okay to be sad, but you can't stay sad. You've got to find a new outlook and you've got to find a new purpose and a new passion. But that's what really woke me up was when I got hurt, I went from being the respected provider to now being the patient. And on that other side of that table of that doctor relationship, I wasn't the doctor, I was the nurse, but I'm talked to like the doctor. They often will tell me more than they'll tell the doctor. And so now I'm the patient, knowing how I related to patients and knowing that if I had a patient that was really authentic and, you believed him. and I never understood why people would not believe that my head hurt like it did. And I literally was searching for answers any way I could find them, and there weren't any. They just, I went to 50 different doctors. I went to Canada. I went to New York City. I went to Florida. I mean, searching for real answers because New York State workers' compensation, because I was injured at work, you go through your employer's workers' comp insurance. And that's a system that is pretty much designed to do anything it can to just say you're okay and go back to work. It is not a patient-friendly system, nor does it care about the patients. And I learned firsthand how corrupt it was because literally the insurance company would actually create these independent medical exams where they pay the doctor to pretty much say, get her back to work. And it was just horrible telling your story and having them literally say, oh, you're fine. Let's just go back to work. Anj, I could not calculate basic math. I could not find words. You would not want me in a life-saving situation taking care of your child. Let's put it that way. And it was such a horrible feeling, letting my family down, letting my, peers down. But I couldn't get a doctor to understand what I was going through. And that's the difference between a visible, you've got a broken arm, and an invisible illness.
Yeah. I mean, it sounds like a really heavy experience. And how did you come to figure out that cannabis could be something that could help you, particularly coming from a kind of conventional medical profession? I would assume that the doctors naturally prescribed normal pharmaceutical drugs to you initially. Did they not work? And then you decided to look at other things in a way to sort of help yourself?
So it was sort of a strange experience. And I believe everything happens for a reason, including my injury. I feel like I have a purpose bigger now that I'm hurt than I ever did as a nurse. So my husband trying to cheer me up because the anxiety and depression was crippling. I mean, I could not leave the house anytime I did anything. I was in chronic pain. And doctors were prescribing more and more pills. Oh, you've got the shakes? Well, let's give you this Valium to chill that out. Oh, you feel too thirsty or you're too bloated? Well, let's give you a diuretic and just fire that on. Oh, how about some high dose steroids? That's really a good idea. So these were all the things I was taking, and they were having a total adverse effect on my brain chemistry. There was these were not happy pills. These were pills that were more and more severe. And my husband, in desperate effort to make me happy, took me to Las Vegas about the end of January of 17, which was about 4 months after my injury. And I grew up in the Just Say No campaign era, the Nancy Reagan, your brain on drugs with the frying egg. I mean, that was who I was. And as a pediatric nurse, if you would have told me your kid was on cannabis for their seizures, I would have probably called the Child Protective Services Division to pretty much have your kid taken away from you. Based on my license, right? It's a Schedule I drug. It's not allowed, especially not with minors. And that was my mental thinking. So I was planning to die in Las Vegas 3 days into our trip. I couldn't go on anymore. I was just totally done. And I'm outside on the hotel balcony, and I realized I wasn't going to be high enough to do any damage. I was peering over the side, contemplating my death. The pool area was 3 floors down, so that pretty much X'd any situation. About that exact same time, a billboard came driving down Las Vegas Boulevard saying, get your medical marijuana card in Nevada today. I literally laughed. I was like, ha! Great idea. And then again, the Nancy Reagan and the egg frying image popped up. And then it came by a second time. And I had smoked weed, recreationally here, there, not frequent. I didn't buy it. If someone else had it, sure, I'll do that. But medicine? No way could I have ever considered it medicine. And my husband came back to the room. He was out for a walk, and I said, oh, hey, we can go get my medical marijuana card today. And my husband's pretty much like the last Boy Scout, so really conservative. For him to even consider this would be a good idea was kind of so he's like, let's go. let's go right now. So we go get my medical marijuana card. I'm sobbing. I'm a basket case. I go to a dispensary. I've got like a 20 something young old kid that's literally has no idea how to help me. None. I mean, I'm just bawling. I'm like shaking, bawling, just crazy shit. And I was given all kinds of edibles, all kinds of like gummies, tinctures, pills, Chiba chews, you name it. It was just a whole collage. And I got 2 joints. And I didn't really want to smoke. I mean, yeah, I'd smoked before, but again, that's not medicinal. And I'm just thinking of sucking, and the way my head hurt and pounded was like, that's not going to be a good idea. So we get to the room, we get back to the hotel, and I eat some of the edibles. I eat some of the Chiba chews, and I'm not feeling anything. I'm still just as sad. So towards the end of the night, I smoked one of those joints. Anjay laughed. I was able to exit that hotel room and go to dinner. I was able to carry on a conversation without sobbing. It gave me a tiny glisten of hope. And then I tried more of the edibles and more of the Chiba chews. And again, I didn't feel the same. And again, I didn't really understand it at that time the way I do now. Looking back, I can explain it and understand it much better. But I don't have a gallbladder, and I have a unique digestive system. I had weight loss surgery. I do not metabolize fat soluble things well. That's why I could eat all these different edibles and consumables, and I didn't feel it. So I smoked that second joint just before we got to the airport, and I flew without a problem. It was a direct flight from Vegas to Buffalo, and I was able to tolerate the plane ride compared to the way to Vegas. I mean, I was inconsolable. I mean, I was like done. And that's what the plant did to me. And then I came back to New York State and was expecting to have the same experience. Just go to a place, get your card, and go to a dispensary, and off you go. But that's not how it was. Chronic pain was not considered an approved condition. And that was a huge problem because all we had at the time were like 6 conditions, and they were all severe. Like you couldn't pull that off. I mean, they were like wasting syndrome, stage 4 cancer. They were really severe conditions. And again, I didn't know what to do then. So then I lost all hope. I got put on more drugs, and I became more hopeless, more despondent. And I had some friends in Canada because I was a dealer at a casino. They offered to, they're like, hey, you're not right. And since this weed stuff helped you in Vegas, we've got weed here. We got lots of it. And, I'll get my medical card, and then you can be legal over here, stay with us a couple days, and then go home, whatever. I became a medical cannabis refugee in Canada. Every other week, I would spend time in Canada. Why? Because I had a quality of life, because I was able to try different medicines, different cannabis strains. And that's when I learned why I don't feel edibles.
And sorry, just for the non-US people, Buffalo is quite north. It's quite near to Canada. Is that right? So it wasn't too difficult for you.
Niagara Falls, Ontario. It's like a 15-minute drive.
Got it.
Yeah. It's not like going to Europe or anything cool.
Yeah.
It's literally 15 minutes. And so I was learning all about the plant and learning what works. And they had this killer app that like had all the back end data of the medical providers that you were consuming. So you could actually determine what cannabinoids and terpenes were working for you. Again, this was only after like year 2 of being this medical cannabis refugee that I began to really understand all those pieces. But it was such an amazing tool, having tested cannabis results on the back end to actually understand what was working. The things I mainly treat with cannabis are my chronic pain, my anxiety, depression, and my cognitive function, my brain fog, my executive function. Being able to communicate is a huge plus of the plant. And when COVID hit, there went my medicine. There went my quality of life. I mean, was in a different place in 2018 than I was in 2020 when the border shut down. But it's still, I counted on those trips. Like, you don't understand. I know more people in Canada in the industry than I do in the US, like legit, because I spent so much time over there. And I feel like they're all my moose mates. I joke because I love moose, and they're like my moose mates in Canada. So Um, I should be Canadian just because of that. But literally, when that happened, I had to learn what the legacy market was, the underground market, and learn about it in a way that it wasn't tested. So, I mean, what was happening is I'd buy all these different products and they wouldn't work because, like, you couldn't smell it, it was in a sealed bag. And I learned what terpenes work for me. And terpenes are basically what gives the plant its taste and smell. I think of them like essential oils without the bad stuff in them. I feel like that is the most not talked about thing in this plant, and that's what works the best for me. That's where I home in. I found that like limonene and pinene really work and energize me and make me feel functioning. Whereas myrcene or beta carotene, I'm like couch lock princess. Like I feel like getting a bag of Scooby snacks and sitting and watching Netflix. But that's not how I want to feel because that reminisces to that brain injury. And I microdose all day. I must smoke my medicine. And finding the right cultivars is amazing. I mean, when I find the right ones, I'm a different human. I don't feel brain injured, but they're usually in California. They're usually in Nevada. They're in Massachusetts. I can't cross state lines with them, even though I'm a medical patient, even though it's my medicine. That is not available. In New York State, our medical program, the COAs, certificates of analysis, lab reports, whatever you know them as, are considered proprietary to the 10 registered organizations. So I know a pharmacist quite well at one of these organizations. We'll just leave that at that. And he was sharing with me, he has kids that have special needs. They have seizures. One of the licensed producers changed their formulation and they omitted CBN. His kids have been on the same stuff and everything was working great. And all of a sudden they started having uncontrollable seizures. He had to jump through huge hoops to get those two different COAs to see what was different. That is a health and safety issue. I have severe allergies to certain things. Certain cannabis has made me react. I was able to figure out at least a range of terpenes that might have been the cause of that when I was in Canada and able to track with this strain print app. But when you buy from the illicit market, you have no idea. You have no idea. None. I mean, a name means nothing. Indica sativa, that is a lazy man's marketing. We need to talk about terpene profiles. We need to talk about other things in the plant. And it's
Yeah.
not about high THC. I mean, and in
Yeah.
the use market, that seems to be what everybody focuses on is how
No.
I can get.
No, completely. It's a weird one, isn't it? I mean, you've done a fantastic job there, Nikki, because you've answered loads of my questions I was going to ask you. And it was really good because it talked a bit about your journey, about how you kind of figured out what works for you. And just, it'd be worthwhile knowing, do you still take prescription drugs as well, or have you kind of phased that out? How's that work?
Funny story. So I was on 16 pills at one point. I'm down to 3. But my psychiatrist, because I still am on an antidepressant, I do Xanax at night, but I was on Adderall. And I told her I didn't need the Adderall anymore. And she's like, why? And I said, cannabis is really helping with it. I feel like the Adderall just makes me crash so hard when I come off it that it's not good. However, I got to confess, I'm on Adderall today. It makes me definitely more hyper, but I don't necessarily want to be hyper. you know, Adderall has been my friend because I've been on it for so long, even before my brain injury. And it allowed me to function. It allowed me to work 72 hours a week for 7 years, own my own business before that. So, I mean, I've always been a very productive member of society. When I found cannabis and started to come off these drugs, and workers' comp just kept saying, well, you're not taking it, so then you must not hurt anymore. But I couldn't tell them about the cannabis, or if I did tell them, it was just a big taboo topic. My workers' compensation, I had a chronic pain doctor that actually prescribed medical cannabis for me. I got it approved by the judge. The insurance company appealed it, so it got reversed. Then I appealed it. And then it got reversed back in my favor. And then they appealed it again. And then the final time I was able to get it. Of course, that didn't happen until like the end of 2019 when I was settling. So it was pretty irrelevant because, it costs so much in New York for our products. And at the time, all we had was ground flower with a THC and CBD percentage. I kept asking about lab tests and they wouldn't give them to me. And I didn't know it was proprietary.
Yeah, that's frustrating. I mean, it's obviously such a key part, and it's something that we talk about on the show a lot about how important those other parts are. Particularly, as you say, through your process of experimentation, you've realized the things that you need and the things that you don't really want. And also really interesting that given your particular physiological situation, that ingesting it, eating it basically doesn't work for your body, basically. And so there's somewhat paradoxical way you're having to smoke it. You're having to smoke your medicine, which must be a little bit strange, right? I think.
It is. And I've been told by neurologists that if I'm smoking cannabis, it's just to get high, that THC has no medicinal value. This is our cannabis doctor locally that actually told these things to me. And meanwhile, he writes a prescription on a prescription pad and says, go downstairs to my CBD store and here's some hemp CBD that's been lab tested. And I mean, what a corrupt system. And like, if didn't know the medical system, I mean, he clearly forgot I was a nurse because we haven't had written prescriptions since like the 90s, right? And to see a written prescription with my name on it, take one tab BID. I mean, like, so it's written in doctor lingo with the signature. It looks like a prescription. If I'm an old person, I don't know any better. I'm just going downstairs to fill it at the pharmacy. And, we all do what our doctors tell us. I fought him on it. He put it in my medical record, and I was denied long-term disability insurance because I was called a drug seeker and said that I was just looking to get high. Therefore, that didn't make me a good candidate for our New York State medical marijuana program. It didn't matter because I had already been approved by my chronic pain doctor, but it's incredibly frustrating when you think you're finally getting to see the man, the expert, that I can just try and understand why smoking cannabis works so well for me compared to anything else. And I mean, this was again before I had more knowledge. And it was so frustrating and it was really devastating. And again, it kind of fed into that, are you really hurt or are you really just getting high? Like it started to perpetuate that little weird voice in your brain that like, are you really messed up or not really? Is he right? Are you really just trying to get high? And then I had a chat with Montel Williams a few weeks back, and it was interesting because he said, cannabis might make you a little euphoric. And I'm like, well, yeah, but is that a bad thing? I mean, I'm just saying, like, you listen to any drug on TV and they have a minute on what condition it is. They have 2 minutes on what it can do to you. And, all this horrible thing, including death. And euphoria is my side effect. I don't know about you, but I'll take euphoria over death. Just saying.
Yeah. There's a weird moral undertone there, isn't there, in terms of like, it's a medicine, you shouldn't enjoy it in any way. But
Right?
if it's like giving you a better quality of life, I think that's probably a good sign, particularly when it comes to pain. But I'm just, I'm conscious of time. What you've done is fantastic in that you've sort of used your experiences now to sort of move into more education and advocacy. Do you mind talking a bit about what you're doing in that space?
Sure. So basically, I went from provider to patient to advocate. And now I'm really trying to educate others on the things I didn't understand. It's Brain Injury Awareness Month in March. And so every day this month, I've been posting about traumatic brain injury and sharing a tiny bit about my story. And that's just blown my LinkedIn up. I mean, I guess the more consistent you post, the better it is, all that stuff. But people really care about patient stories. And I feel at the end of the day, patients need to be considered more. We should have a seat at the table of these licensed producers and these registered organizations because How do you know what's working? How can you do better as an organization and cater to patients? One of the things that's getting lost, and I'm working with Americans for Safe Access to create a New York advisory board. And in that light, we're hoping to change some of the things and be a voice for patients. I don't want what's happened in California and other states where the medical program just goes by the wayside. Oh, patients are patients. We have medical needs. We should not just be lumped into that getting high demographic. So I'm working really hard on sharing the story, sharing my experiences. I'm not a doctor. I don't claim to have all the answers or am not giving it medical advice, but people can learn from each other. And like Facebook support groups are huge in my recovery. They've really helped, hearing from other patients what's working for them, how to have different life hacks along the way. So Nikki and the Plant is an official company, and we're working on product creation and product development along with the research component. So I'm working with Strainprint to white label their app for me so that I can create a data set of patients treating their symptoms for chronic pain, anxiety, depression, and cognitive function. And it will then be a real world evidence data set that I can actually show that to the Brain Injury Association of America. That I can, and again, this is all HIPAA compliant and it's anonymous data. It's not, I'm not giving out people's information, but it's real important that that data is shared because it's real world evidence. And, I didn't understand clinical trials the way I do now and understand how controlled of an environment they are. But we need to get that real information from patients so that we can do better.
Yeah, absolutely. Again, another recurring theme on the show is, the difficulty with clinical trials and plant compounds, and the fact that there are a number of them in the plant, and how do you sort of fit that into this existing regime of clinical trials, which is why the real world evidence is very important. But I think the patient voices are super important. It's definitely a thing in the UK that we're sort of seeing a lot of as well. There are a number of patient groups, but they're not always represented kind of at the business level. And that's kind of my final question, I guess, is around this. And I guess it's even more important in the US because, it can get very corporate. There's a lot of money involved, and often helping people get squashed a bit at the expense of shareholder interest, let's say. How do you see the corporatization of cannabis in terms of patient rights?
Patients are being forgotten, and that's happening all over in every state. And I'm really trying to change that and trying to bring other patients to the table to share their stories. And everyone's story is important. And corporate greed is going to happen. Okay. I'm not suggesting people shouldn't make money on the plant, but advocates are where it's at. Advocates and those that are actually using your products will have much more of an impact on your future business needs than just hiring the big box guy that's got an MBA. If you don't understand the plant in a way that it's helped you or someone you love, you need to learn from other people because this plant is medicine. Yes, it's also adult use, but don't forget about the beauty. It saved my life, Anj. It saved it, like legit. And if I can make one person not give up, then I've done a good job today. And I feel that if I get that voice at these bigger tables where corporate is happening, I think the industry could change, working with pharma instead of hating on pharma, actually having legacy operators and patients and users work with pharma together. Harmony and kumbaya is what I'm all about. It's not about greed for me or money. It's like, let's do right by people. I mean, if your grandmother has dementia, why should she just be this crabby old woman that like everybody can't stand to be around? Give her a damn gummy. Let's have her laugh a little bit. Is that really bad? The kid that has autism that's like beating himself up and beating everybody else up. Why should we deny him medicine that could give him a quality of life as well as the people around him? We're looking at it wrong. Instead of finding the wrong of it, let's find the beauty of it.
Yeah, a very good way to end the show. Nikki, thank you so much for joining me, and thank you for all the great work that you're doing. And I'm really glad that you're finding your voice. I'm on LinkedIn. I'm not on the other sort of social channels, but so I see a lot of you, and it's fantastic. And it's great that you're speaking to loads of people and getting the message out there. So I wish you well with the future, and it'd be great to have you on the show again at some point.
Absolutely. Thanks so much for having me.
No worries. Thank you. Thanks for listening. Hope you enjoyed the show. If you did, please subscribe, rate, review, and share the podcast. It will help me spread the good word on how this amazing industry is developing. I work with various cannabis startups to help them get funded and grow. I also work with corporates and international cannabis companies to help them understand and navigate the European cannabis sector. We're working with some great clients across the cannabis value chain, and we'd love to help you too. Please visit www.canverse.global to get in touch.